of maybe it's not draining well, the patient's complaining of discomfort, there's a bladder, it's distended, there's clots, etc., etc. So first thing you do, I'm going to check my doctor's orders to see what I'm supposed to do. So this is patient Long John. His first name is Saw and his middle is Trey. Saw, Trey, Long John. Yep. And this is Dr. Friesenhands, and he has ordered to irrigate the indwelling Foley catheter with 40 mLs of sterile water times 1 now. So always check your order first. So what I'm going to do now is I need to gather my supplies. I want an irrigation tray. I want a full sterile, unbroken seal of sterile water, an extra alcohol, and at least 2 sets of gloves, probably 3. So I'm gonna go to the room, knock on the door, ask to enter. I'm washing my hands. Okay. So Mr. Long John, identifiers as normal. Check the band, talk to him. Dr. Friesenhands has ordered us to irrigate your catheter, as he discussed when he was in here earlier, to see if we can clear out your tubing a little better. Do you have any questions from what he discussed the procedure to you? Yes or no? Are you having any pain? Yes or no? I'm going to go ahead and assess the bladder area, make sure that it's not overly distended here, and I'm going to wash my hands. Number 2. Okay? Alright, so now I'm going to go ahead and I'm going to put on some gloves. I've already shut my door. I've pulled the curtain. I've ensured full privacy for the patient. Are those sterile gloves or clean gloves? Clean. Non-sterile. I'm going to put on my gloves. And I'm simply going to empty whatever's currently in his bag. At this particular moment, I'm not doing that, okay? Just for demo purposes. But I'm going to empty, and I'm going to take a look at quality, amount, characteristics. So is there clots? Is there sediment? Is it clear or murky? You know, what color is it? And the amount. So I'm going to have that into my container. I'm going to take it in the restroom. I'm going to empty it appropriately. I'm going to take off my gloves, and I'm washing my hands with Drake. Okay? So now I'm going to come to the bedside. I'm going to get my supplies ready. When you guys are practicing in lab, if you want to use a table, that's fine, or a bed instead of this cart. For demo purposes, it's easier for me to show you as it's up here. But this is not that work surface I would have on a patient bed or a bedside table. So I'm going to go ahead and I'm going to have my supplies ready. I want to open up my tray. I want to open up my container. Again, watch how you set this down or you'll flunk. Don't do this. I'm going to set that up there. I'm going to have my alcohol available over here. And then I'm going to go ahead and touch in here. So I'm going to grab my other alcohol that's in here. I want something underneath of my surface. So if you want to use this instead of wasting it, that's absolutely fine. Go ahead and open it up the corners, shiny side down. Just tuck it underneath of your surface. If you don't use this or you don't have one for whatever reason, use a chucks or towel or something to go underneath of that working area. Now I'm going to go ahead, I'm going to reach into my container, and I want to stand it up. I have no gloves on right now, okay? Just going to stand it up.
That was my question. Okay, go ahead.
Okay? I'll put on gloves when I'm really supposed to put on gloves, okay? So, no gloves. Now what I want to do is I want to grab it here and here. Now I'm secure. Doesn't matter how nervous I am, I've got a good grip here, okay? I want to take this end off and lay it down there without touching the inside of it, okay? I want to take my water and I'm going to put it in here. Now today, I'm not doing that. If you want to use that for when you practice, that's fine. But today, I'm not doing that. I have ordered 40. I'm going to put in probably double or triple how much is ordered. I'm going to put that back. At this point, you can recap, or you can recap when you have the syringe back in there. I'm going to break the seal, because the seal is kind of hard. And I'm gonna visualize about where 40 is supposed to be at. I'm gonna put this into my container. I'm gonna go ahead and pull up my solution. I'm gonna let it sit there. Okay? Now, I'm gonna go ahead and put my gloves on.
So this is clean gloves.
These are clean, non-sterile gloves. And now I'm gonna clean the connection between the tubing and the catheter, for the catheter itself. So, rub, 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 15, 30 seconds as we're supposed to do, rub, 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 rub. This area, all through here. So clean, 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 clean. And then I'm gonna let it dry. All right, notice where I have this little bulb. This is the one that we inflate the catheter with. It's in my hand behind here, okay? So now what I want to do is I'm going to go ahead and separate the two tubings, like this. And this is a pink. I'm going to put them both in one hand. I'm going to take that little cap that I threw in here. I want to recap this. Push it on there hard. And now I can set this on my work surface. I can't really write at the moment because it won't stay up there because my tubing the way I have my Foley catheter bag. But I'm just going to put it on my bedside table. That's what you don't want it to do either. So if you're doing it at the bedside, you're going to have it on your surface, like right on here. I figured out this cart to see how easy it is to not let it fall off. But you want that cap to be on there nice and tight. So it's going to be just sitting right here. So now I've got everything in my hand. I'm going to grab the area again here again. Use your thumb as inside the ring. Grab here. I'm going to put this in the center. Push the connections together and let go. And then I'm going to instill. It's bubbling. I'm going to instill my solution. Okay. So that's all done. Now before I do that, I'm going to grab this. I'm just going to move it out of the way because I want this tray now. Okay? So now I'm going to grab this and I'm going to rekink it. Pull these two back apart. Set this back into my container like this. So I'm not touching anything on the insides. Once that's done, I'm going to unkink now and I'm going to let it drain into this container. That way it's a better, you can visualize what it is. You know, you may get a lot back, you might not get much. So I'm just going to let this drain into the container. Once it's finished draining, I'm going to rekink it. Again, I've grabbed that cap again. I'm going to take my second alcohol. This is the extra one that you brought. I'm going to open that up. I'm cleaning here. I'm going to discard that. I'm going to take my catheter tubing that was laying right here in front of me. I'm going to pull the cap off. And I'm going to put the two back together again. Let go, secure them. Make sure that they're nice and tight. And then make sure that your catheter is below bladder level as we're supposed to do anyway. So once that's all finished, I want to take my tray. If you've got a garbage can right by you, you can go ahead and pop that in there. But if it's got solution in it, you need to take it. You're going to have to empty it into the bathroom too. So I'm going to go ahead and check quality, consistency, characteristics, everything that you looked for earlier, you're going to look for again. How much, what color, were there clots, sediment, stringy clots, what was it, what did it look like? So you're going to take a look at that. You're going to have to empty it into a measuring container because this one don't have it's not easy to read because the numbers are too high for what we're flushing with. And you're going to throw this into you're going to empty it in your toilet and then throw this away as you need to. You're going to take your gloves off and you're washing your hands again. Okay? Once that you're totally finished, you're going to make sure this is where you can say you're going to grab another set of gloves and wipe down your surface. Especially if you use the bedside table, you want to make sure that you wipe that surface down. And then you always want to double check response from your patient. So Mr. Long John, how are you feeling? Are you doing okay? Are you having any extra pain? See what you can do for comfort for the patient. Once that's been assessed, I'm going to go out, I'm going to document how much I flushed with, what my return was, and what the characteristics were, and how much I got initially when I emptied the catheter. So that all goes into my documentation. You want to reassess at some point, 15 to 30 minutes later, depending on why we were flushing, to double check not only how he's feeling, but to see what your urine output is like. Okay? Okay. Let me show you what could go wrong. Can you flunk this skill?
Yes.
Easily. Let me show you how. Several ways. Okay. This area here in the piston is the only place you can touch besides this ring. If you touch here at all, when you pulled it up, you've touched here at all, you've contaminated. So both of those. You've touched this, you've contaminated. You've touched this, you've contaminated. You've let this go, or you let it go, you've contaminated. If it touches up in here. And when you've got them apart, if you've touched anything here, you've contaminated. So there's a lot of different ways that you can contaminate. You put your cap down incorrectly, you've contaminated. Okay, so let me pretend, and I'm Susie Q, nursing student. Now I'm really nervous because Prof. Milcran, I don't know about her. And so I'm getting ready to do everything, and I take my cap off the end, and what do I do now? What am I gonna do?
You can't use it.
I can't use it, right? So what am I gonna do?
Start over.
You don't have to start over. You do not have to buy another kit for that patient. That's an unnecessary
Put that
expense.
alcohol cover in it.
You're not gonna use that. You're gonna leave it on the floor.
Mhm.
So what you're gonna do instead, remember how I grabbed this? I'm gonna grab this just like I did and kink it up with my hand just like this. When I take these apart, instead of now having a cap to put on there, I'll just put it in my hand. Okay? Now you have an extra surface that can be contaminated. So you have to be very careful. When I finish, if this is what has happened, which is no big deal if that does happen during demo, if that happens, this is what you're resorted to. You always go to plan B, okay? If you do this with your second alcohol, instead of just wiping this surface, now you're gonna be wiping two surfaces because they both have been exposed. And then you're gonna put them back together, okay? So it's not hard. Now, some of them have asked me, how do you do that with one hand? Well, you will, as you become more proficient in multitasking, it will get easier for you too. I'm gonna if I grab my alcohol, even if I'm like this, just put it in your other fingers and just tear it. It's doable. So you don't have to let go of anything in order to get that other alcohol opened up, okay? And one thing to practice when you guys, besides all of this, is to get used to grabbing this bulb. Grab it before you kink it. Kinking it is what you got to remember to do, or you're gonna wear some fake urine right now, but you will wear your real urine if you're out and I've got gloves on, but still, ooh. So make sure that you get used to kind of pulling that bulb out of your way as you kink it, just like this. There are some facilities that might have clamps for you to use. You need to be used to doing stuff without. And then if you have the luxury with, that's great. But get used to doing without. So as you're practicing, just get used to kind of grabbing the tubing just like this and just pulling them apart at that point. Now, the real tubings are very difficult to pull apart. We are demoing non-sterile gloves, but asepsis with pieces of it. If you have a sterile gloves on, at some point you've got to touch here. And these do not come apart easily in real life. They're very difficult. As a matter of fact, the catheters and the tubings that are inserted on the floors, they have like a little seal on here that you'll have to break. So you can't do it with one hand. So therefore your sterile hand in the very beginning becomes non-sterile. So we're showing you with non-sterile gloves, but showing you the pieces that has to stay sterile. Okay? Okay. So kink it. I mean, it's not a tough one, but make sure you have a good, Prof. Pyle has a lot of fake urine in here, so you're really going to have some stuff coming back if you don't have it kinked up well. And if you, like I said, if you want to use a bed or a table surface or something to practice on, to get kind of used to having this tubing closer by you, so that instead of hanging on the side on the cart, so that's more realistic, like you would have on a bed, you can do that too. You just wanna make sure if you cap the end of that tubing, that even though the kid's capped, you don't want it to fall on the floor. So you wanna keep it right near you in your work area, okay? If you meet resistance, are you gonna push? No.